So, a anginal pain that happens during the activity or a emotional stress only, not at rest, only during emotional stress only, then you call it as stable angina. Now, what is meant by variant angina? What is the other name given for the variant angina? It is also called Pringe-Metal. You always maintain one 200 pages notebook. So, first time it looks like a rocket science, but there is no rocket science. It's so easy. Only thing is you should understand the concepts, and you should try to apply all this knowledge on the patients. That's very important. And you should keep discussing with the doctors and the fellow colleagues and the concepts. Then the subject is very easy. Right? Now, what is variant angina? Variant angina. Any temporary increase in the blood vessel is like a tube. It can undergo constriction, it can undergo dilatation. So, if it constricts, that's called vasospasm. If it goes into vasospasm temporarily there is a decrease of the blood flow to the heart. And that is called variant angina. And typically the patients are young women with chest pain, temporary chest pain due to temporary vasospasm. What is that called? Variant or Pringe-Metal angina. Quite often these women also have other parts of the body has blood vessels, no? Not only heart. So the blood vessels going to the cranial vessels, to the head. If there is any vasoconstriction, what do you get? You get migraine. Quite often these women also have migraine headaches. Then there is something called Raynaud's phenomena. What is Raynaud's phenomena? Typically these people, suddenly when there is any exposure to cold, their blood vessels will go into intense spasm, so they become pale. The hand become pale. So this phenomena is called Raynaud's phenomena. Quite often the people, these young women who have variant angina, they also have Raynaud's phenomena, and migraine headache is what you should remember. Now let us talk about the definition of various types of angina. What are the three types of angina I told you? Stable angina, unstable angina, and variant angina. You have to be very, very sure. So, stable angina, let's talk about it. Typically it is a chest pain when the heart muscle is not getting enough amount of oxygen-rich blood. It is a chest pain or a discomfort, especially when the person becomes emotional or whenever they are walking or exerting themselves. Unstable angina. Unstable angina is also called ischemic discomfort. Why it's called? Now you need to know some important terminology that will help you basically. Yeah. A little bit of the terminology. Yeah. So, what is meant by ischemia? Ischemia, any decreased blood flow, is called blood flow or blood supply. Blood supply to any organ. It can be liver, it can be heart, it can be lungs, it can be brain. That's called ischemia. Ischemia. Then, when the blood flow is low, then the oxygen supply is also low. Then the muscle become necrosed. That's also called necrosis. Necrosis means it will become dead. And that is called infarction. When the ischemia lead to necrosis, then that is called infarction. So ischemia means, we all very commonly use the word ischemic heart disease, ischemic heart disease. What is the meaning of that? That means there's a decreased blood flow to the heart. And when that leads to necrosis of the heart muscle, that then you call it as infarction. So before infarction occur, what's happening? There's a decreased blood flow. So suppose if the coronary artery, which is supplying the blood flow to the heart, it is having any occlusion because of a blood clot, a blood clot inside the vessel. What is the term used? It's called thrombus. What is thrombus? Thrombus is a blood clot inside the blood vessel. Inside the blood vessel. Then you should know a word called embolus. What is the meaning of embolus? If this thrombus dislodges from the blood vessel and it started floating and reached a faraway location, like a clot inside the heart chamber has flown to the spleen on the left side. So it has flown to the spleen, let us say, or it has flown to the liver, or it has flown to the lungs, then it has floated there and then it blocked another blood vessel. That is called embolus. Embolus is a floating thrombus. Thrombus is a blood clot inside the blood vessel. Ischemia is a decreased blood flow, and infarction is the necrosis of the muscle. The muscle is dead. That is called as the infarction. So this angina, called unstable angina, typically is called the pre-infarction angina. If you don't treat it, the person will end up in myocardial infarction. That means it is significantly blocking the blood vessels. So to call angina unstable, there are 3 criteria you should remember. Number 1, if the angina is at rest, whereas stable angina occur only when you exert a lot or when you become very emotional. So if it is occurring at rest, and usually it lasts, if it is lasting more than 10 minutes, if the patient's chest pain, angina is lasting more than 10 minutes, these are the very important questions you should remember, examiner is going to ask you. And if it is very severe, you should ask the patient, is it like your regular chest pain? No, it is very severe, the patient told you. Then if it is a new onset, that means just 4 to 6 weeks, in the recent 4 to 6 weeks if it is started. And if it is a crescendo nature, what is meant by crescendo? Crescendo means if something is elevating, that's called crescendo. So if it is a crescendo in nature, it continued to get elevated, then you basically call it as unstable angina is what you should remember.